everyone. Thank you for coming. My name is Katrina Harvey. I'm a certified medical assistant who works at Bronson Center for Women. We do mammograms and ultrasounds. We do screenings and diagnostics. Diagnostic means there is an issue. Could be a mass that you found, your doctor found. So when they do screening mammograms, we have radiologists. Radiologists read your mammogram. When they read your mammogram, they check through that, make sure that they don't see anything that is not normal, unusual. What they do, they all have you come back for what we call additional views. So every day we have 10 to 15 papers. It has a report that has your name, has your birth date, and lets me know that you need to come back and visit us. So that means, so I put in your order. So the order means that I put in that, okay, the doctor wants you to have a mammogram, and it's the left breast. And these are the pictures. I put in the order to let the techs know that this is what the doctor would like them to have done. So they come in to visit us. Then, when they have their additional view, the radiologist takes a look at them and lets them know exactly what's happening and if they need anything. So if the radiologist finds something while you're in your office and then you need a biopsy, the radiologist fills out this nice little sheet, which is called a pink sheet. Yes, I know it's white. We all know it's white. But on this pink sheet, it lets me know what patient it is. Lets me know their birth date. Hard to find a patient on your schedule with no birth date and no name. So this lets me know, and this also lets me know which biopsy the doctor would like you to have. So we have ultrasound biopsies, a stereotactic biopsy, which is a mammogram, use the mammogram machine, and an MRI. So this is given to us, to the medical assistants, and also the nurses. So they will also help to schedule patients for their biopsy. Then once we also get that, we fill out one of these slips. This slip is what we call our worksheet. Worksheet means it keeps track of the patients for us, has their birth date, their phone number. Can't contact a patient unless you have a correct phone number. Yes, it might be in the computer, but that doesn't mean it's correct. So we always ask the patient, so that's why we take this in with us so we can ask them. So that's what those look like. Also talk to them about what they would need on the day of the biopsy. Please take a shower, wear dark clothes, and please wear a bra.
Why dark clothes?
Why dark clothes? There are times that, yes, we get it to stop bleeding before you leave. That is our number one. Every once in a while, it starts bleeding again. All right, you're in a white shirt. Of course, now you've ruined your white shirt. So if you're in at least a dark shirt, it doesn't ruin your clothes.
Why do you have to wear a bra?
Wear a bra. The most important thing of the whole topic. The reason that is because you get an ice pack. And what I mean by that is we want to make sure we tuck an ice pack in the bra to help any swelling or any bruising. And if you don't have a bra on, how do you put an ice pack on the breast? Impossible. So you get an ace wrap. Yes, we take an ace wrap and we wrap those around your breast. And I go get somebody to help me because it's very hard to walk around a person. Did that today. So you always get help because you have to have somebody hold one side to get it to go around, and then you get this way and hand it to the person that's helping you. And the reason no bra means you can't put the ice pack where it needs to be. And the reason we have to have an ice pack on is the swelling and bruising, and you need to do that ice pack 30 minutes on, 30 minutes off. So okay, you got a 30-minute drive, you need to have your ice pack.
How long do you have to ice it for?
30 minutes.
No, altogether.
8 hours.
8 hours altogether? Yeah. Okay.
So and then you do 30 minutes on, 30 minutes off. You know what? And you don't want the ice directly on the skin, so you got to make sure we're right over the gauze that we put on the biopsy site. So also no deodorant. And the reason we say that is after you have an ultrasound, any of the biopsies, you have a mammogram. And the reason you have a mammogram is because they also put this nice little clip, which is a titanium marker. Titanium marker is the size of a sesame seed. You do not feel that. That's what they look like. Different shapes. We have different shapes for each biopsy. Ultrasound has shapes. MRI has their own shapes. And also the stereo biopsy has their own shapes, which is the mammogram biopsy. The reason we have to have different shapes is you can have more than one site that needs to be biopsied. My main part of the biopsy is I set up the tray for the doctor.
So do they stay in there?
If you don't need surgery, they do stay in there.
Okay.
It's kind of a souvenir to remember, oh, guess what I had? I had a biopsy. The trays that I set up, they have lidocaine and lidocaine with epi. And the reason we have is all set up nice. Each doctor has a different way they like their tray set up. So they have their lidocaine with epi. This one doesn't have a needle on it. That's for the stereo biopsy. And that means it hooks to the machine that runs the needle for the stereo biopsy. And it gives you medication as they're doing the procedure. Then you have your little tweezers, and the reason we have tweezers is they take the specimen, they put it in this little petri dish, and they take a picture of the specimen. And the reason they do that is most of the stereotactic biopsies are done for calcifications, and the only way to see those is under mammogram. So that's what that looks like. Also, before the patient has a biopsy, they have to sign a consent form. Yes, I'm out of order, I'm sorry. And the consent form gives us permission to do the biopsy. Unless you sign this consent form, you don't have your biopsy. So you have to give us permission to be able to do the biopsy. So you have to make sure that you sign that. Also, with the consent, when they go over, the doctor goes over with them, but the time of the biopsy, and they also put their initials on their breast. And the reason they put their initials on their breast is you need to know if it's the left breast or right breast. And so that lets them know that that's the breast that needs to have a biopsy.
So who explains the procedure to them before they sign the consent?
The doctor explains the procedure to the patient. So they go over everything, and then when the doctor's done explaining to them, I talk to them, I go over what we call a teach back. So I ask them, do you have any questions about your biopsy? Do you understand which breast we're doing the biopsy on? Are we doing the left or the right? We ask them that. And we ask them, do you really want to do the biopsy today? Because if they don't want to do the biopsy, we're not going to make anybody do a biopsy. If they say, nope, I'm done, I'm out of here, then we don't do the biopsy. They have to sign the consent and say it's okay that we do the biopsy.
Is it typical to find the lump and then do the biopsy in the same day, or do you typically have to schedule out to do it again?
Yeah, just unfortunately we don't do them usually in the same day. Every once in a while we do a biopsy in the same day, but not very often. Usually the schedule is pretty tight.
Okay.
Because we usually do up to 6 to 7 biopsies a day. So
how long does it take to get back in for that biopsy?
we try to get you in that week. So you come in on Friday, we try to get you in the next week. If you get in on Monday, we try to get you in by the end of the week.
So has a doctor actually tried to do a biopsy on the wrong breast? Have you ever had that?
No.
So
Yeah,
they're really certain before they do anything.
Yes. Actually, the sign that is protocol. So that is what our hospital has us do. So in like the doctors that do surgery, it's more important surgery-wise because the patient's not talking with us or talking with them for surgery. The patient is talking with us through the whole biopsy. Pretty much that's what I do. I talk with the patient throughout the whole biopsy. So when we have the biopsy, I'll show you what the needles look like. So this is an ultrasound biopsy. And they use this needle, and what they do is they has a little end, goes in and gets tissue. Specimen comes out. And then they put that in a formalin container. Formalin container goes down to pathology. Pathology looks at that. It should have results back in 2 to 4 business days. All right.
How big is the area that they take out?
How big is the area they take out? Very small. The tip of my fingernail, it's very, very little. And it doesn't need stitches. We put steri strips on that, and they'll stay on for 2 to 3 days. And when they come off, that starts to heal. It has a scab.
How many samples do they take?
Each doctor is different. Up to 3 samples, 3 specimens. So each one takes a different amount. I've never asked why they do that, but they all have their own system. So each doctor has their.
Can I eat and take my meds?
You can eat and you can take your meds. Please eat and please take your meds.
Are there any medications you're not allowed to take?
Blood thinners. So what we do is we have the nurses, they'll get a hold of the doctor that prescribed you your blood thinners. And the reason if you stayed on your blood thinners, then you might have bleeding and some issues, and then like a hematoma, which is blood underneath the skin, like a bruise. So when that becomes hard and things like that. So if you're on blood thinners, this helps that you don't have that.
Is it just blood thinners, or can you take aspirin?
You can take aspirin, but if you are on blood thinners and aspirin, then so that's why it just depends on what other medications you're on. So we have to.
How long is the procedure? How long do you have to be there?
You're there usually for a good hour. So you're there in the beginning to talk with me. I go through all your vitals, and then the doctor comes in and does the consent. And then the procedure itself is not more than 15 minutes. It's the prep and pictures. They got to make sure they're in the right spot.
How long is recovery time on this?
24 hours. You need to take it easy.
Oh, that's
So
it?
no lifting, no pulling, pushing, vacuuming. Housework's out the door, so your husband gets to take care of that for you, or boyfriend. Gets to cook you dinner, all that good stuff.
Can you shower or take a bath?
Yep, you can shower. You can take a bath.
Is there any follow-up after the biopsy?
Nope, not unless you're having issues. If you're having problems, you need to come see us then.
What issues?
Issues, infection. So it starts to get warm. You can feel that. You have a fever. You start to have any discharge, anything like that.
How high is the fever?
How high of a fever? Well, anything over 101.
How do you get contacted about your biopsy results?
Our nurse navigators give you a call. That's why we double check that phone number, because if you don't have the right phone number, you don't get your results.
So it's all done over the phone,
It is all done over the
whether
phone.
you're cancer or not?
We do have patients, if the radiologist is very, very sure that it's cancer, they'll talk to the nurse navigator before they leave the office, before they even have the biopsy. And that's usually when the doctor is pretty 100% sure.
So if it is cancer though, they'll just call you, they won't call you into the office, they'll just call you and then refer you to an oncologist or?
Refer you to a surgeon.
Okay,
And the nurse navigators help with setting that appointment up. And then they're there and they help you through the whole process to make sure that you're going to your appointment. So you need an MRI. They also help make sure that they get the order and they get everything help sure that you are going along and going step by step. There are those that
so you have someone to walk you through the entire?
yes. Yep.
You do multiple sites on the same day?
Yes.
So if I come in for additional view, and they're telling me I need a biopsy and you schedule it, do I go home not knowing what this biopsy is going to be?
Which biopsy that you're gonna
Well,
have?
But I think I would be scared if someone said, you have to have an ultrasound biopsy, come back next Tuesday at 2 o'clock. Say, okay, well, what's an ultrasound biopsy? Does anybody explain that to me before?
Yeah, either our nurse navigators will explain it to you or I will explain it to you. So we sit down with you, we go over every step, let you know this is what happens, this is what the doctor does, this is what the medication that he'll use. I show the clips, I don't know where they went. Oh, it's alright. But so they get to see the clips, they get to see what they are, we go over the medication. I let them know that yes, you will have some pain. Usually the worst pain is usually the first initial poke with the lidocaine. Then after that, that starts to numb the area.
So if I have questions before the biopsy, do you have websites or do you have a phone number I can call?
We do have a website, and the website that we give them is on the back of the card. So we write the date, time, and when they're coming in, and then on that little card also has the website, and they can go on the website and look and see what the actual biopsy is.
Oh, okay, thank you.
When they do the mammogram one, are you actually getting a mammogram done?
You will get a mammogram after the biopsy.
Oh.
So yes, because we have to take pictures before the biopsy, we have to make sure we're in the right spot.
Are most of the abnormalities found at home during mammograms?
Can be at home when you're doing that self-breast exam monthly. Also can be found by a doctor, so you go for your yearly checkup. So you have your pap smear, they also do a breast exam. They can be found by your doctor. Any other questions? We're gonna wrap it up here pretty quick, so anything else? No?
Thank you. Thank you.
Very informative.
Yes,
Thank you.
yes, appreciate it.